If you were worried about pharmacists being able to prescribe your medication, just get a load of this. As many as 1 in 10 doctors could have no degree at all and never have been to medical school. That's under a new scheme to let school leavers go straight onto wards to train on the job as doctors through an apprentice scheme. Joining me live now is Dr Saleyha Ahsan, who's worked on A&E wards, and a director of the Higher Education Policy Institute, Nick Hillman. Good afternoon to you both. Let me start with you, Doctor. I mean, everybody's in favour of apprenticeships. Everyone thinks learning on the job's a jolly good idea for most professions, possibly, though, with the honourable exception of doctor. I wonder how you feel about this.
You know, when I first saw that this morning come up, I thought it was a joke. Honestly, I had to check the date. I cannot believe it. I'm horrified. I'm just not going to sit on the fence with this. I think it's an appalling idea. I'm really concerned about it. I think it's a route to cheap labour. For a number of years, doctors were concerned about how their progression through the system was being halted by, you know, we weren't being called doctors on the job. We were being called service providers, service provision. So our progression through our careers was more to do with service provision. That's what we were being called. It's all about service provision, not being a doctor. Now the route is to cheap labour, unpaid labour. I think it's dangerous. I think it will offer a two-tier system. And frankly, which patient is going to want to be seen, or their loved ones to be seen, by someone who isn't a qualified doctor in the way that we know it?
Am I right, Doctor, in thinking this is the absolute diametric opposite of what's happened with nurses? That nurses used to learn, or many of them at any rate, on the job, and now we insist on a degree in nursing. We don't have nurses learning on the job anymore. So this is kind of implying that nurses need a degree and doctors don't, which would be absolutely baffling as a concept, wouldn't it?
I agree, Vanessa, it's baffling. I'm just gobsmacked. And I'm so sorry. I think that's everyone calling me because they're so appalled by what's going on. My phone hasn't stopped.
Just tell me a little, Doctor, about what you actually learn at medical school and whether it matters or not, and whether you need an extensive knowledge of anatomy and physiology, or whether actually being a doctor is the sort of thing you can pick up on the hoof just by listening in and paying attention. I mean, because I would imagine you're quite busy during those years at medical school, aren't you? Learning all sorts of essential stuff that you might actually need to know in order to make a diagnosis or perform an operation or anything else.
You know, I came to medicine late. I served in the army before I came to medicine. So I had a professional career before, and I returned to medical school. It was an incredible experience. I was sitting, going through the hallowed gates of medical school and sitting in the lectures and absorbing that knowledge that I have drawn on the rest of my career over the 14 years that I've been a doctor. I have drawn on that. Not only did it help and provide crucial knowledge, and it's not just superficial knowledge, it's the depth of knowledge that you have, that you do draw on. It's an understanding of the breadth of medicine, what exists, on all the attachments that we go on. We understand the different careers and the opportunities that exist in medicine. You practice time is set aside to practice safely without the pressures of a ward. Often enough, actually, when you were a medical student and you were on clinical attachment, because the ward was so busy and the qualified, experienced doctors were getting on with the job and the nurses, you often didn't get much of a look in because there was very little that you could do, and people didn't have time to always teach you and train you. If you were on a quiet ward, something that doesn't exist now at all, you would then get a bit of an opportunity for some training, but the chances were you'd be forgotten in the corner.
Let me bring Nick in on this. I mean, you're listening to this. Our doctor thought it was a joke. I saw the front page of the Telegraph today. School leavers can work as doctors without earning a degree. School leavers will be able to start working as doctors without going to university under NHS plans to fix the staffing crisis. I didn't think it was a joke, but I was awfully worried about it. What do you think about it?
Well, I agree there's a lot of confusion around today, partly as a result of that newspaper story. But my understanding is that what is going to be on offer when the NHS workforce plan finally arrives is the ability to become a doctor through an apprenticeship, but you would still have a degree as part of that. So it's really learning on the job. You would be paid while you're doing it. I think it would be perfect actually for people who come into the medical profession later in life. But look, you're not going to go into hospital as a patient and be looked after by someone who's just arrived as an apprentice. They will be learning from other doctors, and at the end of their course, they'll end up with exactly the same sort of degree verified by the General Medical Council as your other guest and every other doctor in the country have. And there is a massive shortage of doctors and nurses in the country at the moment. So I actually think diversifying routes into the medical profession is probably a very sensible thing to do, but we still need to see exactly what the government's proposing.
But Nick, the idea that you can learn on the hoof to be a doctor, I mean, you can learn on the hoof to be a barista, you can learn on the hoof to be a waitress, you can learn on the hoof maybe to be a tour guide. You might, if you really pay attention, learn on the hoof to be a geography teacher, but I think that was a great stretch. But learning on the hoof to be a doctor, what are you supposed to be overhearing as an apprentice? How are you meant to be sort of absorbing and subsuming the kind of arcane information that doctors have to learn on the hoof? How can you possibly do that? And the implication that it's all right because they'll end up with the same qualification. What you're really saying is that what medical students do full time, which is study, they'll have to do kind of in half time, because the rest of the time they're going to be, as the doctor has just said there, unpaid and on the ward, or paid very little and on the ward. So they'll be working at a very reduced rate of cash and then have to study in the time that they have left over. And as far as I'm aware, there is no time left over because there's so much information to absorb. Doctor, help me out here. I'm trying to kind of argue your corner here.
Every doctor learns on the hoof.
And you're doing a great job, Vanessa, on that, because I absolutely concur. Let's rewind to COVID. We know that during the COVID pandemic, medical students who hadn't even made it into the clinical years, who were still in their preclinical years, were drafted up to work on the COVID wards. I mean, that's, has someone seen that as an opportunity to, to further this idea? It's dangerous. We have been brought to this position where we are now, where we are understaffed, by ludicrous permeations of different health secretaries trying to, reconfigure the train set. We had Jeremy Hunt doing terrible things to the junior doctor's contract that, of course, made people think, do I really want to stay here and leave? What you're seeing right now is the shortfall that has been created by the mismanagement of subsequent health secretaries over the last 10 years.
Nick Hillman, is this just a kind of rudimentary way of filling a terrible, terrible deficit and lack of medical staff? And it's almost laughable if it weren't so urgent and so worrying.
No, it's not, because every medical professional learns on the hoof. Even if you're doing a regular medical degree at a regular traditional university, you do something called a clinical placement, and you're shadowing doctors and you're learning on the job. This is simply that you're spending a bit more time in the hospital and a bit less time in the sort of traditional learning environment. But look, this will not happen unless the General Medical Council and the medical profession themselves accept this is a valid route to training. This is not something the government is forcing on people. This is something that young people like apprenticeships and the medical profession are open to diversifying the routes into the medical profession. It will only work if the medical profession rubber stamp it, and if there's demand from people, often not young people actually, people later in life coming to the medical profession who don't want the traditional university experience. They're ready to get stuck in straight away. These people will not be doctors until they've got a medical degree at the other end, but they'll emerge with no debts because they'll have a salary while they're doing it. And it's just another route to the same end job at the end.
I'll give Dr Ahsan the final word on this. I mean, Nick is convincing and he is plausible and he has our best interests at heart, I'm quite sure. But is he right?
I don't think so, with due respect. I mean, yes, the debt is a consideration, but 10 years ago, prior to the hike up in fees, doctors didn't have to train with these humongous fees. There's lots of other routes to solving this problem. This quick fix, cheap labour route is not the answer.